Welcome to Nursing School.
Welcome to Nursing School.
Part 2. Death and Dying. Stages of dying. Dr. Kübler-Ross identified 5 stages that people pass during dying process. 1. Denial. 2. Anger. 3. Bargaining. 4. Depression. 5. Acceptance. The first stage, denial. The first stage, as Dr. Ross views this process, is that of denial. Person is disagreeing on what is going to happen. Reject the situation. Person thinks like, this cannot be true. Feelings of isolation. He/she may search for another healthcare professional who will give a more favorable opinion. He/she may seek unproven therapies. The denial may be partial or complete and may occur not only during the first stages of illness or confrontation but later on from time to time. This initial denial is usually a temporary defense and is used as a buffer until such time as the person is able to collect him or herself, mobilize his or her defenses, and face the inevitability of death. The second stage, anger. The person feels violent anger at having to give up life. Why me? Feelings of rage, resentment, or envy directed at God, healthcare professionals, family, others. This emotion may be directed toward persons in the environment or even projected into the environment at random. Dr. Ross discusses this reaction and the difficulty in handling it for those close to the person by explaining that we should put ourselves in the client's position and consider how we might feel intense anger at having our life interrupted abruptly. The third stage, bargaining. The person attempts to strike a bargain for more time to live or more time to be without pain in return for doing something for God. I just want to see my grandchild's birth, and then I will be ready. Patient and/or family plead for more time to reach an important goal. Often during this stage the person turns or returns to religion. Promises are sometimes made with God. The fourth stage, depression. Usually, when people have completed the processes of denial, anger, and bargaining, they move into depression. Dr. Ross writes about 2 kinds of depression. One is preparatory depression. This is a tool for dealing with the impending loss. The second type is reactive depression. In this form of depression, the person is reacting against the impending loss of life and grieves for him or herself. I just don't know how my kids are going to get along after I'm gone. Fifth stage, acceptance. This is the final stage of dying. This stage occurs when the person has worked through the previous stages and accepts his or her own inevitable death. I've lived a good life, and I have no regrets. Patient and/or family are neither angry nor depressed. With full acceptance of impending death comes the preparation for it. However, even with acceptance, hope is still present and needs to be supported realistically. Many factors influence how individuals accept death. Personal values and beliefs about life, views of personal successes, both financial and emotional, the way they look physically when experiencing the dying process, their family and friends and their family's attitudes and reactions, their past experiences in coping with difficult or traumatic situations, and, finally, the healthcare staff who are caring for them during this process, all affect an individual's attitude toward dying. Loss, grief. Loss occurs when a valued person, object, or situation is changed. Types of loss. 1. Actual loss. It involves any loss of person or object that can no longer be felt, heard, known, or experienced by the individual. Loss can be recognized by others including the person sustaining the loss. Valuing is unique to each person, but the concept of loss is common or understood by others. 2. Perceived loss. Loss felt by the person but is intangible to others. 3. Anticipatory loss. It occurs the person displays loss and grief behaviors for loss that has yet to take place. 4. Physical loss. Loss of an arm from a car accident. Physical loss. 5. Psychological loss. Loss caused by an altered self-image and the inability to return to his or her occupation. Grief. Grief is emotional and behavioral responses to loss. Grieving is the process of feeling of acute sorrow over a loss. This process is painful experiences, but it helps survivors to resolve the loss. Grieving is a normal, but it can become abnormal when a person cannot accept someone's death by manifesting the bizarre or morbid behaviors. Dysfunctional grief, type of grief which occurs when there is prolonged emotional instability, a withdrawal from usual tasks or activities that previously gave pleasure, and the lack of progression from one level to successful coping with loss. 1. Disenfranchised grief, grief which occurs when the societal norms do not define the loss as a loss within its cultural or traditional definition. In this case, the client is not acknowledged for the loss and does not gain support from others too. Anticipatory grief, it occurs when the process of grieving starts before the client has died or a loss has occurred.